And this is time sensitive now. It's that time of the year, after all, when schools are going back. This might be one of the most important reasons, when you really stop and think about it, for all of us to wear face coverings. We're asking our kids and their teachers to mask up. And our kids should not be getting mixed messages throughout the day. When they leave school grounds, they need to see that everyone is doing what they're doing, that best practices are best for all, by slowing or stopping many times the unknowingly transmission of COVID-19. Our order will require masks or face coverings for anyone 8 years or older while you are in public indoor spaces and commercial entities, when using public transportation or other vehicle services, and in outside public spaces when it's not possible to be socially or physically distanced from people who are not from the same household. And of course, a statewide mandate means we'll require mask use in schools. Members of the Indiana State Teachers Association ask that students in the 6th grade and above wear masks. We will apply mandatory mask wearing for students in the 3rd grade and above. Faculty and staff, volunteers and others who may be in a school, or for co-curricular or extracurricular activities, with exceptions for strenuous physical activities. The order will, of course, need to have exceptions. I fully realize that. For example, for medical purposes, exercising, and obviously eating and drinking. Now, I know not everyone will be supportive of this mandate. Compliance and enforcement are always in question. Our approach, if you recall, since day one, since the very beginning of this pandemic, has been an approach of education, of appealing to one's civic duty and public good. You might even say public pride in being part of the solution. And it will continue to be. So while not wearing a mask, when and where I just stated before, is a Class B misdemeanor, please know the masked police will not be patrolling Hoosier streets. When I asked you months ago to hunker down, you did. We did. And we slowed the spread. It's just factual. And we protected our hospitals from becoming overrun. And we managed our supplies and our supply chains. And as we've reopened segments of our economy, we knew cases would increase around the country and in Indiana. But we stuck laser focused on our 4 guiding principles. And while we have continued to fare better than many other states, now we have to hunker down in a different way, which is why wearing masks will become the fashion of the day. Again, it's just a fact. The simple act of covering our faces, as odd as it may feel, can help us prevent the transmission of the virus, which again is why this is the next prudent step that we as a state need to take. As educators across the state have worked to finalize their back-to-school plans, our health professions in particular have fielded many, many questions. There's a lot that continues to leave us with unknowns. But Dr. Box, Dr. Weaver, and Lori Ramsey, the registered nurse Dr. Box has brought on board to help directly work with schools, have all been talking to educators on a regular basis to answer questions and to respond to their concerns, and we'll continue to do this every day forward. How to prepare for a positive case in a school is a reoccurring theme, understandably so. Dr. Sullivan and Dr. Weaver have developed specific guidance, and I'll ask them to walk through that here in just a moment. But first, let me add a few more personal comments about school openings. First, there is no more important task before us than returning students safely to school for instruction. Our Back on Track plan states that schools may resume July 1. Staying in stage 4.5 for any period of time does not preclude schools from opening or require modification of their efforts. Second, as I stated this last week, and I want to say it again, I will not set a single start date for the entire state for schools to begin. This is up to your local school systems. School leaders have developed and adopted excellent return plans. I've read many of them, reviewed a lot of them, and I know educators and students alike are eager to get back at it, to see one another. We remembered how they were physically separated just months ago. There are hybrid approaches and face-to-face approaches, and we hope phased-in approaches, bringing the youngest back first. Some schools have decided to begin the academic year 100% virtual, and I respect that decision. And I hope it's only temporary. But I want school districts to be very mindful of what that decision means holistically for the family. Some families will not have childcare or another location for their child to go to have a good learning environment. So it's important, so important, for school districts that chose offering virtual education to also consider the impact on students and their families, and I know they will. Please consider opening your buildings and providing transportation for students who need a safe site to participate in their online learning while virtual learning is in session. Next, I want to encourage all schools, every one of them, to apply to the Pandemic FEMA Public Assistance Program, to become eligible for reimbursement for supplies needed for safely reopening all of your facilities. The deadline to apply is July 31st, the end of this month, via directly the FEMA grants portal. Finally, let me just say that the Indiana Economic Development Corporation, in conjunction with Langham Logistics, estimates it will have delivered 1.1 million masks to 228 schools and school corporations by the end of this week. That means in the first 6 days, not weeks, days of this program, we have delivered more than half the total number of masks requested statewide. We are getting it done together. We expect that nearly all deliveries will be complete by August 7th. To assure you that we don't miss anyone, we'll post this information on our Back on Track website. So any school or school district that may not be on our list for whatever reason knows how to directly reach us.